Hey, welcome back to the Closers here. Happy to have you alongside for a Thursday afternoon. Alongside Jay Sparks, I'm George Young. It's time for our Missouri Orthopedic Institute segment. Don't forget about their free clinic on Saturday mornings over at the Missouri Orthopedic Institute. And it goes from 9 to 10 a.m. It's a fully staffed clinic, x-ray machines, and they also have the ability to get you referrals. But it's best to get it taken care of. When in doubt, get on in there. Free clinic on Saturday mornings. With us today, it is Dr. Brian Toedebusch. And we've not had you on here before, but welcome aboard. We promise to be gentle. This won't hurt. Just relax and breathe deeply.
All right, sounds good.
Okay, very
Glad
good.
to be here.
Specialty, low back pain, right?
Yeah, I do non-operative orthopedics, sports medicine at MOI, and I see everything from the head to the toe, basically.
Okay. All right. So, and non-operative is really the place a lot of people would like to start. So, from a non-operative standpoint, when you look at an injury, is there no pun intended, but is there a breaking point where you look at it and you go, nope, I got to send you up the ladder here?
Absolutely. I mean, we see a lot of acute injuries that come in, but about 90% of injuries that occur with sports are actually non-operative. Our training is to be able to distinguish, okay, which ones are ones that we can keep non-operative, or is this something that, you need to go next door and talk to one of our surgeons about. So that's part of our training that we specialize with.
And with that, as you, as you look at that, how does that work with preventative versus post injury? I mean, if you're non-operative, obviously you're trying to give people preventative ideas, but then how does that all blend together?
So typically a lot of what we see starts out as non-operative and can become surgical for the patient, but we go through a non-operative regimen of treatments that often are successful in treating whatever injury or chronic pain that they may have. But if they get to the point where they're not responding to those typical treatments that we would do initially, like physical therapy, injections, and bracing options, then there are some diagnoses that could become more operative in the future.
Okay, we've heard in the past, they went in for and I'll use Marcell Ozuna, outfielder for the St. Louis Cardinals, had a cortisone injection earlier in the baseball season, sat out for about 15, 18 days, and then came back. Cortisone injections, how effective, how often?
So it really depends on the diagnosis, what we're using a cortisone injection for. Cortisone injections can be very effective for treating pain related to an injury. So an example with Marcell Ozuna is he had a rotator cuff problem, and his pain was limiting his ability to throw. So obviously to shut him down in the middle of the season would have taken him away for the rest of the possible postseason at that time. So they wanted to avoid surgery and help him with his pain, so that's why he went forward with the cortisone injection in order to keep playing for the rest of the year. So typically we do see a very positive response to trying a cortisone injection, and there are times when patients don't do as well. That could be either because it's in the wrong location. So sometimes we'll actually use special ultrasound equipment to guide our injections to make sure it's in the right location. Or it's possible that they're not going to get relief from them. But typically, there's no side effect to at least trying a cortisone injection one time. As far as how many you can do in the future really depends on the diagnosis as well. There is known to be toxic if you had too much cortisone. Okay. So what we typically rule of mouth is that we'll say one cortisone injection every 3 months, and those can be repeated as often as necessary. But it really depends on what you're using it for.
Dr. Brian Toedebusch with us here on the Closers, the MOI segment. Again, free clinic on Saturday mornings from 9 to 10 a.m. It is targeted generally toward the football player, but it really doesn't matter if your youngster is needing attention and you want a referral, get on in there. Again, the free clinic from 9 to 10 a.m. on Saturday mornings. Low back pain is one of those weird things where you don't have to even be an athlete to have low back pain, but we've seen it a lot, whether it's in basketball players or in football players. What's the non-invasive procedure for handling something like that?
Well, most back pain actually is non-invasive, and there's only a few causes of a low back pain that would become urgent. And so first of all, when we're looking at someone that has back pain, we want to decide, is this something that's urgent? Is there a risk for letting this go without treatment? And so we call those red flags usually. And the red flags that we would look out for is a person getting numbness or tingling in certain areas? Do they have weakness or difficulty walking? And that's a sign that there could be nerve damage going on. Some other red flags that might be a little bit more concerning for us is if the patient has weight loss or they're having night sweats. Those are kind of unusual symptoms that let us believe that there's something else going on besides just run-of-the-mill low back pain for somebody. So our first step is to usually figure out, is this a back pain that might be more serious, that could cause some permanent damage, or is this something that that we can continue with non-operative treatments for?
The non-athlete can go through life pretty much, stretch out and do various preventative things. But what about the high-end athlete? When they come in and they're complaining about low back pain, is the treatment regimen different for them to try to get them A, back healthy, and B, back out on the field of competition?
I think our treatment approach is very similar.
Okay.
We just have a few more options available with a high athlete. So first, we want to determine what's causing the low back pain. And predominantly with our adult population, we see that low back pain is more associated with sedentary lifestyle or not exercising much, which is kind of counterintuitive when you think of an athlete that's having low back pain. Mm-hmm. And so typically when an athlete has low back pain, it's on the other spectrum. Are they doing too much that's causing their back to be irritated? So an example of an athlete that's too active would be like a gymnast or a swimmer and diver, somebody that does a lot of extension or leaning back with their sport at a repetitive, does that repetitive activity over and over again. And they can actually develop a diagnosis that we call spondylolysis, which is a stress fracture in the low back. And for those athletes that do have an injury due to repetition, we actually have to shut them down and prevent them from doing that activity. But ultimately, we get somebody in a rehab program, just like with someone off the street like you or I, that's having low back pain. And there's a lot of benefit to properly training the back with exercises of strengthening and stretching for the back.
Exercise, huh?
Yeah.
Interesting.
Yeah.
We'll have to look into that.
Make a note.
Okay. And we heard also wrist is another one of your specialties where you're kind of dialed into, and George and I call high school football. And as the season goes along, you see guys out in warm-ups and more as the season goes along, you'll catch 2-3 guys, and they've got that nice wrap on, and fingers are open, thumb is open, but it's something going on there. And when guys are out there and again need to get back out on the field and feel that urge to compete, how can you take a wrist injury and say we can get you to a point that you can still help your team?
Mm-hmm. It depends on the diagnosis again.
Right.
So obviously something like a fracture is a little bit more high risk, and then we also have to think of the big picture. So how old is this athlete? What's their participation level? What position do they play? Are we talking about a freshman in their first game that has a displaced radial fracture? Probably not a good idea to go back out there.
Right.
Mm-hmm. But if someone's a professional athlete and they have a stress fracture, something that's not going to need surgery, then using the proper protection, they definitely would be able to play with a protective cast on them. We actually I work with some high school football teams in the area too, and we had a whole run of wrist injuries and hand injuries this year, so it is quite common in football. And some of those athletes we had to sit out because of the high risk of their injury, and some of them were able to go back to play with a cast on.
What I know we've talked back and we've talked wrist injuries, but then Dr. Brian Toedebusch with us, Missouri Orthopedic Institute. What area is for you? Do you find not only the most challenging but the most enjoyable to kind of dive into?
The most enjoyable part is just meeting the patients and watching them as they recover. Typically, there's a lot of nervousness in the room whenever we have an athlete or their parents come in, and they're wondering, first of all, am I going to be able to play again? Second of all, if I'm not able to play, how long is it going to be till I can play again? And third, maybe they think they're still going to play again. I just have to kind of reinforce that this is something pretty serious that we need to take it easy. So for me, what I get the most pleasure of is helping the athlete and getting them through their injury and getting them back on the court so that they can compete again and do what they like to do.
Biggest challenge as a physician?
Having patients follow through on your recommendations sometimes, especially with teenagers. Sometimes it goes in one year and out the other year, so it's always nice if the parent is along there as some reinforcement once they leave the room.
Yeah, and you can ask the parent, and they will tell you a lot of the same thing, that it just goes flying in. That's why you have their head up against the wall to maybe stop it so it trickles back in again. Mm-hmm. But is there an injury group that you've done research with, or that you're interested in doing research on?
So right now I'm not participating in any research. Mm-hmm. In the past, I've done some research dealing with some regenerative type of treatments, such as PRP was something that I studied a little bit when I was doing my training. And I'm not currently doing any studies, but it's something that I'm always considering about getting back into and doing more research for that.
Okay, as we get closer now, I knew there are half the teams involved this week that there were the previous week, but still the recommendations would be the same. You're getting ready for that Friday night, and I know the coach tells you, and it's in one ear and one out right on out the other, but to ensure the best possible healthy outcome on a Friday night, football field, soccer pitch, basketball court, whatever. Give me a couple of things for the athlete to be remembered.
So don't be afraid to talk to your team's trainer if something's not right. That's why they're there at the game. They're not there to keep you from playing, but they're there to keep you safe and play without getting hurt right now. And also make sure you're having fun out there too. So if you're having a lot of pain and you're not enjoying the competition, then you probably shouldn't be out there playing right now because you're going to make things worse.
Dr. Brian Toedebusch, backs, wrists, Missouri Orthopedic Institute. That's the guy to take a look at. And don't forget about their free clinic on Saturday mornings from 9 to 10 a.m. Full referrals are available, and it's a fully staffed clinic as well. So if something doesn't seem right, parents regarding your athlete, whether it's that fuzzy mind thing, that could be indicative of a concussion, bumps, bruises, you know the drill. Get them on in there, 9 to 10, free clinic. It's the best first step that you can take. Doc, thank you much for your time. I appreciate it.
Of course. Thanks for having me, guys.
You are very, very welcome.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.